Is it better now?
Yes, and we have gone live also now.
Great, great. Thank you so much, guys, for waiting for me. Uh, let's start. I think it's already 5 minutes beyond the set timing. Good. So, a very good evening to all of you, and thank you so much for joining the webinar. I'm Dr. Astha Gaur. I lead marketing strategy at Janitri. At Janitri, we've always believed that some of the most important conversations are the ones that we do talk about. So we talk extensively about pregnancy. We talk extensively about the kid. We talk extensively about the nutrition, vaccination, the milestones, breastfeeding. And somewhere between all of that, we forget to ask a very simple question. How is the mother doing? And that is exactly what brings us to today's topic, that is postpartum depression. When we finalize the topic, we realize that this topic cannot be discussed with just one lens. Therefore, we brought together three different perspectives of a mother who herself supports women during prenatal and postnatal phases, a psychologist, and a psychiatrist. So, first we have Mrs. Ankita Singh, a mother, a certified yoga therapist, founder of BindWithYoga, with over 8 years of experience in women's wellness and having supported more than 500 women. Ankita brings a unique perspective, a lived experience with a professional understanding of pregnancy, postpartum recovery, and maternal mortality. Next, we have Ms. Vrishti Kapoor, co-founder and consultant clinical psychologist at Anubhav. As an RCI licensed clinical psychologist, she has worked extensively around emotional well-being and maternal mental health. She brings to this conversation the psychological lens, helping us understand what happens emotionally and psychologically during this transition into motherhood. And we have Dr. Anubhav Katyal, a practicing psychiatrist who is currently associated with NAS Foundation and Tulsi Healthcare with over 10 years of experience. He brings the clinical and psychiatric perspective to this conversation. So today we have a mother, a clinical psychologist, a psychiatrist, exactly the three different perspectives that we were planning to have. So, Ankita, I'd like to begin with you. From your experience of working with women during this very transformative phase, what are some of the changes you commonly see in women after childbirth? And at what point does it look like a normal postpartum adjustment starts becoming a cause of concern? Over to you, Ankita.
So, firstly, thank you, Astha, for organizing this session because I believe when I am dealing so closely with the women out there, and especially those who have just delivered the baby, they have a lot of questions already. And now with this forum, it's easier for us to, bring all those things to highlight and, talk about it. So, as you mentioned, I've worked with more than 500 women altogether. And the major questions that especially the new mothers ask me is that they don't know themselves anymore, right? So basically it's all about the identity crisis, and I'm sure all those new mothers who are watching this live, they will be able to relate with this feeling of that they don't feel themselves anymore. And I would like to add a yoga perspective to this, that there is a reason that why this happens. Not everything has happened just by just like that, right? So it has to be coming from so many physiological changes. Come on, you have made a baby, you have carried a baby for 9 months, and just in 9 seconds or 9 minutes, you cannot feel like that you want to go back and bounce back into your own self, so called. So, especially the westernized culture has given it so many names of postpartum brain and postpartum mind and so many things. But at the end, so many physiological changes are happening in a woman just after the delivery. And let's not talk about post delivery, let's talk about the 4 weeks before your expected due date. So the very last month of pregnancy is all about your energy pulling it downwards. Why? Because your baby comes into the pelvic area, the entire universal power, your own prana, is just pushing you downwards. So, altogether, the last month has been pulling down energy. And altogether, once you deliver a baby, you can't expect the same energy to drive up. Right. So that imbalance in the body, which is there because of those, prana variances, which we term as hormonal imbalances in the body, is a major cause why this postpartum thing has come in picture. So this was talking in terms of physiological level. Now there are reasons which happen even, in terms of your surrounding. That especially once you deliver a baby, whichever setup you have, whether you are a nuclear family, whether you're, with your in-laws or anyone around, there are females who complain, the new mothers who complain about that no one is understanding me. Because altogether there is a shift that everyone is talking about baby, whether the baby is doing fine or not, whether the baby is being breastfed completely or not. But no one is asking and talking about how is the new mother doing. Is she feeling okay? Has she adjusted to the new changes? Because she is also trying to accept her new identity. Maybe you are a first time mom, everything is new for you. Even if you are a second time mom, you are still having one more child to take care of yourself, one, two, whatever it is. So every time the pregnancy is going to be different, and every time there are going to be new changes that you need to accept. And then last but not the least, breastfeeding is a, I don't know what, taboo in India, I would say, that the moment the baby is born, no one guides you how breastfeeding needs to be done. No one guides you what needs to be eaten at the right quantity or what proportion, so that, the milk production is in a better quantity. But the moment baby cries, it is just put on the mother that you are not feeding properly. The milk is not sufficient for the baby to fill up the tummy. Altogether, everything is a question for a new mother, and hence that imbalances do come in them. So physiologically body is changing, prananically your body is changing, and mentally your body is changing. So this causes differences where you don't feel normal anymore. When I say normal, means you don't feel in your mental body the way you used to feel before pregnancy. So yes, this can be solved with a so-called concept of acceptance. If you accept these changes happening peacefully, you're going to enjoy your motherhood journey. But you should know the difference when it is just normal to accept that, and also when do you need a psychiatrist or a psychologist helping you to identify this area, and you need to work on it somewhere.
Exactly at this particular point of time, I would like Vrishti to pitch in. Exactly at the point where Ankita left the conversation, Ankita left on a note that it is very important for us to identify that this is the exact time where the mother needs professional help. We clearly randomly says it's just hormones, it's just a new phase of life to her, but at what point of time do you, Vrishti, think that this particular mother needs a professional help? Yes, over to you,
Right.
Vrishti.
Again, thank you for having me. And I'm glad we are talking about this because it's experienced a lot but rarely talked about. So here we are. To begin with, one change in the name, that is postpartum depression, is not anymore considered postpartum but also perinatal. That means it may begin and mostly begins way before you actually deliver the baby, or you actually go into that phase where the baby is now into the world. So it can begin. You may identify the signs as okay, this is confusions, probably because hormones are changing now. So very few people would actually go into identifying it as a clinical concern because they will get away with it or let it pass. It's okay. Right now, we are coming with a lot of changes, and this is one part of it. So we need to accommodate, we need to adjust. Instead of going and seeking help, we need to just absorb everything that is coming our way. But that's where I want to tell this to everybody who's watching this, that you do not have to face this alone. You would still be facing it or taking it head on, but you can also do it along with us walking by your side as your healthcare professionals. Right? It won't make you less of a mother or a less of a parent. You would still be you. So, coming to the technical part of the question, generally we consider it as clinically relevant when 2 to 4 or probably 8 weeks after the delivery of the baby, you begin to feel symptoms like mood changes. You may feel extremely low, overwhelmed, irritable, anxious also. Even though the word says depression, it can still have you feeling an anxiety or feeling anxious. Then you feeling a lot of lack of energy, which we also call fatigue. Your sleep disturbance will also be there. But again, you will try to reason out that, okay, this is because the baby is not sleeping, or the timing is not predictable for me. So it's also the same, and that is how it's going to be. But no, even if the baby is getting proper sleep, and still if your sleep is compromised, that is another sign that you need to consider. That why is it that the sleep is getting disturbed or not proper? Then your appetite may also change. You may feel that you want to eat more or less. So what we call as emotional eating, that is exactly what may happen at this time, or rejecting any sort of food also can happen. Then loss of interest, another indication of why we would want to go for professional help, is that I'm feeling that what I was actually waiting for these 9 months, I'm not able to enjoy it. I want to hold the baby, but I cannot feel that bond. I'm outrightly rejecting it, but it's so scary that I cannot share these thoughts with anybody. So these types of thoughts can come, and that is normal if this is happening, if postpartum depression is occurring to you. So do not feel afraid from identifying these thoughts, actually verbalize them, right? Then there can also be that anything that you're trying to focus on. Again, so for 9 months, the target has been your baby. But now that you're seeing the baby in front of you, you're not able to focus on the baby. You may get feelings like, I feel like hitting the baby if the baby is crying too much, for instance. So this is another example that you may sometimes feel agitated towards the baby. And if it is getting very frequent, that is another sign. So all of this. One more important thing is that you may not want to interact with people. Your social interaction may decline. So all these different indications help us understand that it's time that we need some professional help. So that is the answer to the question.
Very well covered, Vrishti, I have to say. You have highlighted some very less talked about aspects of this particular ailment. Now, Dr. Anubhav, coming to you, at what point do we need a psychiatric intervention, and when do we say that this is coming to a point of depression from the point of distress? So, where do you come in the picture, and when you do come in the picture, how do you tackle this entire thing?
First of all, of course, thank you, Astha. Thank you, Janitri, for organizing this very important dialogue, very important discussion. So I'll talk from a clinical psychiatric point of view and perspective. But before that, I would also like to highlight that, of course, every mother and every family, every so-called patient comes from a particular context. And whenever, you're visiting a professional, that professional always has that in mind. So often, when we, one second. Yeah, when we have mothers, when we have people coming in the clinic, there is often a not really a stigma, but there's a lot of apprehension that we might get this label that we're depressed, and that might, of course, have problems in the family and everything. So that's not always necessary. I mean, I think it's also important for the clinician to realize that where to draw the line between pathologization and over pathologization. I think Ankita summed it well. How there are certain normal adjustment issues that can arise, and of course, Vrishti also talked about when these symptoms occur and they also cause dysfunction. That's when you should go for a professional consult, whether you go to a psychologist or a psychiatrist. I think we all work in collaboration, and of course, a good clinician would always refer whenever necessary. So honestly, I mean, what the literature says is around 30-35% of women will face something called postpartum blues. It's a normal adjustment reaction, and usually the support from family, support from especially the partner helps. But when when that's not helping, when it's causing a lot of dysfunction, and when the baby's health is also getting affected, can get affected, it's always better to have a consult. You can always And having a consult doesn't always mean that you will be given medications. And also, medications are only given for a certain point of time in certain situations. I think here I would also like to highlight some red flags that one should keep in mind, such as suicidality, this thoughts of harming the baby, thoughts of harming self, severe guilt, hopelessness, feelings of helplessness. These are the things when you should really consider professional help, whether it's a psychologist or psychiatrist. And also, not very often, but depression can also result in psychosis. I do not want to create a scare, but there are instances when depression also worsens. There can be psychotic symptoms as well. So I think that is when you definitely need psychiatric consult. Yeah, I think also one more thing I would like to highlight that of course in this current atmosphere also, we will have people who have had history of mental health issues, mental disorders, mental illnesses in the past. Pregnancy, perinatal period, pregnancy, perinatal period, postpartum period does increase some likelihood for relapses of those illnesses. So one should always be mindful, and even if you're on medications before pregnancy, during pregnancy, it's always advisable to not stop them abruptly. But just do it in consultation with your doctor. So I think this is something, I wanted to highlight.
That was a great perspective, Dr. Anubhav. And it generally happens that the depression goes into the psychotic phase. And that is where the bell rings and the people come for help to you. So now that we have discussed the entire problem, the signs and symptoms, and the features of a particular mother who comes up to any three of you and asks for help. So now we will come to the treatment part and the solution part. So again, starting with you, Mrs. Ankita, and mothers will be coming to you with very common phrases like she doesn't feel like herself, as you said. She is not, she's not particularly happy about the childbirth, which she has been looking forward to from a long time. And when she uses such phrases that point to the postpartum depression, it may not be diagnosed exactly that, but when it points to something like that, how do you tackle it from your end?
So, Dr. Astha, firstly, when Vrishti was stating the entire situation, I actually resonated it word to word as if I'm hearing my own story. So, it has been rightly phrased that this is exactly what the mothers are feeling. And as Dr. Anubhav, he mentioned that 35% of the females, so I think he's referring to the global status. But when I talk about the stats in India, it is 63% females that who goes under postpartum depression, that they are not even aware of it. And it takes for few mothers for just few months to get back into their own mental self, but it takes even years for few of the females to new mothers to understand that they are into certain situation. So whenever people who are like pass out from my prenatal batch, firstly they are all aware of it. So I'm really glad that on some level I'm contributing to little bit of their mental health. But yes, there are certain things which definitely cannot be controlled, because prenatal is a very fancy world. You are so much excited for the baby, and all the media flourish things in terms of decoration, the rooms, clothes, and this and that. But when it comes to the reality, you feel like, oh, the baby is in my arms, what to do next? No one has talked about it, right? Whether it's about breastfeeding, whether it's about food, whether it's about the hygiene of the baby, and in fact so many things that comes to in reality once you hold your baby. So yes, I always ask all these new mothers that firstly give your body 6 weeks of rest. Nothing to be done, just adapt to the new changes, accept your new journey. And also lot of changes are happening already at your physiological level. Your upper body is changing, your breasts are going to get enlarged, and lot of muscular changes are going to happen in a body, and most importantly your uterus is trying to get back into the shape. So thinking about that physically, let me, keep on doing this or that. No, 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 no. Please don't do it. So for those 6 weeks, please take the break which your body deserves. And gratefully, our Indian law has given us 6 months of mat leave. There is a reason why 6 months period is given. So you need to accept that as a period of recovery and healing. So when it comes to the solution of all these things, what the mothers are going to face, I take care of this particular element in my prenatal program. And once they, successfully deliver their baby, whatever mode of delivery they had, they have to wait for 6 weeks or 10 weeks after their delivery. Like normal delivery, 6 weeks, C-set, 10 weeks. And once they are back, then I invite them for my postnatal program, where I take care of their all the changes that are happening at a mental level, at an emotional level. We are already a community of more than 300 mothers who are helping each other, who are taking care of the smallest doubts that they are having, because I don't welcome any doubt as a major doubt. Even a silliest question is welcomed in the group, so that you don't feel alone in this journey. So I can help them in terms of asanas, I can help them in terms of sharing of their emotions. But whenever it comes to the mental level, firstly, the physical body needs to be taken care. Once you start working little bit on your physical body, eventually you feel happy about it. And once you start feeling happy about the acceptance is there, you're physically working out, things start falling in place for you. And when you don't feel like that, I'm doing yoga, I'm taking good diet, I'm doing everything that my body deserves, but still I'm not feeling the same, is a point where you need little more support. So that is why, like Dr. Anubhav mentioned, we are working together. Not just one element can help you here. You need to know when it is the right time to now go for the tier 2 of an expertise. So you can start with yoga, but if still certain things are there that you need a guidance from, you need to go to a counselor. And don't take it as a taboo that someone will call me mental or someone will question my motherhood identity. You do your thing, and why you have to tell to the world that you are taking certain things, right? Keep it personal and enjoy your journey as much as you can. So yes, this is where I would divide the layers as per tier 1 yoga, tier 2 the right people who are already sitting here.
Such an interesting take. And the most refreshing part that you mentioned was that you start taking care of it prenatally, right? And that is so important to help them understand what's coming for them. So now, Vrishti, when a mother comes to you, I think she's cognizant enough of the fact that she requires professional help, right? She's not battling that inside her head. She's not overthinking it. And she's just come to you, "Ki, I need help." How do you take it forward? How do you tackle that in terms of solution?
Yeah, so that is a wonderful question, very relevant. But before I answer that, I would want to quote this very common saying that it takes a village to raise a child, but it also takes a village to raise the mother who's also newly born. Right. So, which is exactly why we as a community are always there for them. Coming to the question, again, I would take reference from what I just quoted, that before helping the mother with specific therapeutic support, I would want to go first to the family who needs to know more than the mother who's already having a lot on her plate. So, I would want to go from the family, then to the mother. So my intervention would first start with family, psychoeducating them, helping them understand what is exactly happening. Vedika, you know, because somebody within you must have raised somebody, and that is how you know. But somebody within you would have also gone through the changes who can now mirror that, see that. So just try to reminisce and see what the person in front of you is going through. And in this, I would also want to highlight the husband who's now the newly made or new father, who's also vicariously going through something, who is supposed to understand, comprehend, but cannot feel because not inside his body. So that is also a very, very difficult experience, which we need another day to discuss in detail. But coming back to, yes, supportive therapy, addressing the family, helping them understand what can be the signs and symptoms you can look for, how you can help the mother, probably not interject with what you think is right, maybe play by the ear, listen more to what she wants, because she knows what is happening inside her and inside somebody who was inside her for 9 months. So she knows the best. full stop. That is one. Second thing, there is this gold standard treatment for postpartum depression, that is interpersonal therapy. Now, this type of therapy addresses three core concepts specifically. One is role transition. You're not just a woman, you're not just a daughter, a sister, a wife, or whatever. You are also a mother now. So this role is very new for you. Nobody actually delineated it for you, that this is what is to be coming, this is how you have to work on it, and this is how you have to respond. So that is where you will feel the clashes are coming in. You will feel confused. You would not want to take certain roles, that, oh my God, my bladder is hurting, I want to go to the loo, but I have to wait because the baby has just wet the diaper maybe. So these are actually real-time problems which we cannot imagine unless we actually try forcefully to imagine this. It's absolutely real. So the role transition first. Second would be the grief and loss. The grief of how I felt, how I looked just a few days ago. I don't look the same anymore. So when we talk about the pregnancy glow, that is also because of the progesterone levels rising, and you're like, oh wow, sunshine. That suddenly dips, and now you're not the sunshine anymore. But when somebody comments on that, that hits, and that is absolutely no. So again, family interjection, we need to tell them what you not have to do. And same for the woman, we need to help her understand, help her process through the grief and the loss, which she's still trying to comprehend. Okay, how my appearance from now on will be like? What is it that I can accept? What is it that I can process? The third part is the interpersonal difficulties. That also changes, specifically between mummy and papa. It changes many folds. So how do we need to understand, how do we now solve the conflicts that we first used to do by shouting at each other, throwing a pillow at each other? Can we do that now with a tiny, teeny human being right in the middle of the bed? How else can we do it now? So those kind of concerns we can address with this third concept. So this is a beautiful therapeutic approach, and I think I would do that.
Great. I think this was genuinely like an amazing perspective to that. And secondly, the comments, if they could stop, not just during the pregnancy, during the postpartum, or any time for women, we would be living in a very different world. So yes. Now coming to Dr. Anubhav. Dr. Anubhav, when do you think that, okay, when a woman comes to you after, of course, this is a collaborative therapy, a psychologist, a psychiatrist, they work in collaboration. When a woman comes to you, what do you think? And then when you have diagnosed it as a postpartum depression, what are the medications or interventions that you plan to go ahead with, considering the symptoms and signs that she presents? So how do you tackle that? Yeah.
Right. I think so. Again, I would like to highlight that every kind of solution, every kind of treatment has to be individualized. And of course, in my practice, I always have a collaborative approach, not just with other professionals, but especially with the person who's presenting to the clinic, whether it's the mother or, sometimes even it's the partner. When I also say context, we're also thinking about a very normative relationship. We might just have a single mother. We might have a mother with disabilities. We might have a mother with mental illness in the past. So that's where context really comes into play. And that's where we would decide whether I want to go ahead with medications, or do I think that, maybe some psychological support, maybe certain kind of therapy, somatic therapy like yoga, like meditation might also help. Coming to the part of medications, I think, okay, so when we're talking just about depression, of course, the main stay of treatment is antidepressants. And right now we have huge variety of antidepressants. We individualize it according to side effects, according to their whole, if there are any comorbidities or what's happening with the body, what are the expectations, and how long are we gonna give this. But also, we're always aware, as clinician, I'm aware that postpartum depression can also mean something else sometimes. because postpartum depression is often seen in bipolar disorders. It can be a precursor to postpartum psychosis. So that is something we always focus as clinicians and kind of have to rule that out. Sometimes also I've seen that people do self-medicate with antidepressants, especially when they've had episodes in the past. But that is really not advisable because, especially if the mother is breastfeeding, there are different drugs that are, might or might not suit the mother, might not suit the baby. And same for sleep medications. I think sleep medications are also something that sometimes people get over the counter also in pharmacies and everything. Although it's strict now, more strict at least in metro cities. But yeah, one has to be very careful with sedatives. And also, I mean, always discuss with your clinician, what are we expecting? What changes are we expecting? And how much time can we expect those changes? What are the side effects? What do you have to be careful about? And what to notice in the baby? Just for instance, sedatives. Some sedatives do cross the breast tissue and go into the breast milk. So we have to be careful whether the baby is more sedated or mother doesn't get too sedated or gives breast milk while she's lying down. So these are all the things that should be discussed in the consult in the clinic. And also I think this comes very, I would say medications come very late. I think before that there has to be community support. There has to be support from family, friends, partner, and then, like Ankita said, if you think it's not getting resolved or things are going out of hand, definitely take a consult and always discuss what options do you have. Whether you want to also go for psychological treatment. Sometimes, people might not be able to afford according to time or finances. So that all has to be discussed. So it has to be very individualized. Yeah, that's all I'd like to say for this.
Great. As it was touched upon by all three of you, the one most important support that a woman expects, her husband, the father of the kid, and family in a larger picture. Before the therapist, before the psychologist, before the psychiatrist come into the picture, there is one person, I think, whose support will change a lot of things for her. What do you think, all three of you? I'll start with Ankita here. What do you think, Ankita, a parent, the other parent, the father of the kid, the husband can do, or the family members can do in order to support the mother during this phase? Over to you.
So I think here, more than any other support, it is about the responsibility of taking care of the baby, and both of you are responsible for that. So let us say if the mother is awake 24 hours because she doesn't have a sleep cycle, she has to wake up every 2 hours, 3 hours to feed the baby. So, and with all those studies which we have studied in terms of you should have 6 hours of sleep, you should have 8 hours of sleep, but nobody talks about a new mother who is not sleeping at all. So she will be sleep deprived, she will be emotions deprived, she will be jumping on everyone's head. That's so normal because you have to understand that sleep is an important element. So if the partner, because in some organizations in India, the partner is given a paternity leave, which I think is for 15 days, but I'm not sure whether all the organizations are even following such policy or not. So, firstly, even the paternity leave should be for a longer period. That is what I believe in, so that they can contribute little longer, in that very starting phase. But let's just assume, not make any assumption. Let's talk about the reality. So even the male, see, everyone thinks, and every new mother takes male as a very negative picture, that I am taking care of the baby, I am awake all through the night, you are sleeping, what will you do, and all such questions. But at the end, even they forget sometimes that your partner has to wake up in the morning and go to office. He has 9 hours, 10 hours of office to take care, and then if he comes back home, even if he takes rest for an hour or two, it's okay, then jump on his head to take care of the baby. But we need to respect that even for the males, it is a life-changing experience. They have never, come across such situation in their life if they are a first-time father for sure. But on the other hand, a mother has been connected to the baby for 9 months of her life. So even the baby was inside or outside, she will always be high on her hormones and the instinct that I am the one who has to take care. And trust me, all the mothers out there will agree on this thing. Even if they hand over the baby to the fathers, that, for 2 hours, please take care, let me go for a nap or anything, and if something happens to the baby or he or she cries, then they will be the ones who will be running out of the bed just to see what did you do wrong, right? Because somewhere you don't trust the other person, be it your own partner, the father of the baby, right? So the new mothers have to realize that trust is something you need to do on your partner. Whatever he has number of hours with himself, with you as a family, make the best out of that. And also do your conversation, talk to your partner. Don't, because see, as girls we are always in always explaining our counterparts, you should do this, you should not do that. But altogether, once you become a mother, you're so much into the baby that you forget that communication does play a role. So you need to communicate to your partner also, what do you feel, and if they are going wrong somewhere, it's okay to guide them, right? Because you both are learning this journey together. You are mother, he's also a father, and you both are together as a unit in this journey. And yes, family does play a role. And all the mothers out there, please trust your mother-in-laws, your mothers, your nannies, whoever are there, coming there as a support. If you're not going to trust anyone, you're going to go zombie in your whole journey of motherhood. So you need to trust the people around you. And yes, if they are going wrong, guide them. Talk, communicate. That will surely give you the solution for your this journey.
Totally agreed, Ankita. We really need to communicate what we are going through, and especially to our family members, and especially to the father of the baby. Now, over to you, Vrishti. What do you think when it comes to the support that is required by a mother from her husband or family at a large extent? Yeah.
I would actually talk a bit more about the preventive approach first before going towards the intervention part. That the preparation starts early on from the perinatal or even before that period, because it is very similar to how you prepare, choose, research when you want to marry somebody. You discuss all the finances, coping skills, fights, all of it. Similarly, you both need to be on the same page. You're a single unit to somebody that you've produced for the world. So you need to understand, educate yourself, learn how or what it takes to raise a human being. Discuss what your individual orientations are, what can be certain points of clashes. Make space for those clashes beforehand so that when they actually occur, you know that, okay, probably my partner or the father of the baby wants to be a little handsy with the baby versus I just want to be okay, let me stay away. It's like opposing views. So make space for those, talk beforehand, research, study about it. This seems like a very heavy duty project when I'm talking about it, but this is as necessary because what you're going to produce is going to remain there for you with the lifetime. So this is like itna banta hai, itna to banta hi hai, right? So that, and we when we come about talking about what happens or what support they can provide during this phase of postpartum depression, that is when they can again play by the ear. First, talk to the mother, ask her what is it that she wants. She may respond with, I do not know what I want, I'm just feeling very confused, overwhelmed. Probably then take the help of a third person who can diffuse the communication between both of you. And the third person being someone who's trustworthy for both of you, not just one of you. So if let's say you're bringing in, for example, your mother in between, may not be okay for your wife. You're bringing in her mother in between, may not be okay for you. Bringing in somebody who's both of yours friend. So if we start from the community, at this level, bring in a friend who can help both of you, be that moderator for some time, then slowly transition into explaining it to each other, writing something on sticky notes, something as simple as that. You can do that for her if she doesn't have that much of time at hand, for example. So things like these can help in a lot. And of course, taking therapy for yourself, even when she may not have time for herself to go for the professional help, can also be a game changer. So that.
Very well explained. Very well explained. Now moving on to Dr. Anubhav. Dr. Anubhav, how do you think, what importance do you hold in terms of the support that has to be given by a father and the family?
Right. Yeah, before coming to that, I think would again like to emphasize what also Ankita was sharing, that rest is the most important thing, in postpartum period. Uh, often I think what I've also seen in the clinics, working women especially present with a lot of guilt and shame that they're not able to do enough, they're not able to go back to their jobs, they're not able to contribute to the household. But I think this is where the support also comes in, that it doesn't always have to be emotional, it also has to be physical. I mean, not everybody can, or mother might not always want emotional support from everybody around. Just physical support, just helping in household chores, making sure the mother is resting, taking mat leaves. This is the most important thing. And if you have depression, if you have any other mental health issues, mental disorders, illnesses, I think even then, we always in psychiatry and side disciplines, we always talk about the biopsychosocial model. That is, there is biology, there is psychological, there is social aspects to any kind of illness, disorder, whatever. Of course, biology we can work out with medications, but psychosocial is often, not taken into consideration. So you really can't let go of the support. I think, in fact, the mother, or even, if the partner also is undergoing any mental health issues, they need more support rather than, that, okay, the person is on medication. Why are they now not productive? Why are they now not, their usual self, what they used to be? Because this is not how it works. The recovery will need that support, and more than what, other mothers might need. And of course, very important part is exercise and nutrition. Also, these depression and any other mental health disorders often make the person neglect their own self. The self-care decreases, and often mothers, what we've seen is that more focus is on the child, and the mother also doesn't focus on herself. The self-care declines, and it further worsens when there is depressive disorder. So that really has to be taken into consideration, and the main role also comes of the partner, that they're also responding to the needs of the mother, even sometimes when they're not expressing. And in such, not just in disorders, otherwise also, I mean, the mother might not want to share it also, that they're going through something. Of course, creating that safe space, and also dealing with patients is also very important. Also showing up, if you are going for consult, just showing up with the mother as a partner to these consults, talking about your problems, psychological problems, whatever you're facing. And I think, like Vrishti was saying, the interpersonal therapy is the most important part, because the psychosocial issues are, they are relational. So when we're talking about IPR issues, interpersonal therapy really comes into play, and medications are just a part of it. I think support, I would definitely say that nothing will work without that support. Yeah.
Exactly, nothing will work without the support. Now I call upon Miss Roshni Jaiswal, who herself has gone through that phase and will share her lived experience and what you know, she got through, how she got through it, and what support did she require and got in terms of tackling that particular thing. So, Roshni, over to you now.
Thank you so much. It was great listening to you all. And most importantly, I'll tell that I'm a mother of two. And I think with Ankita, with Astha, I keep on talking about how pregnancy changed you a lot as a woman. And then you feel like you want to support other women. And when we were discussing about this topic, that we want to do this topic, the clear mindset was that how do we reach out to women who are really in need. And then we see news like this, that even you guys were talking about societal issues that people go through, hitting the baby, throwing off the baby because of certain fights. So to start this, I would like to tell you one thing that has really impacted in when you become a mother is the relationship that you share with your husband. If you are lucky enough to have a supportive husband, still there can be fight, and we need to be ready about it. So because when you become parent, in Hindi we quote it like this कि माँ पति पत्नी बनने से पहले आप माँ बाप बन जाते हो जब आप माँ बाप बनते हो. Like you want to be good father, good mother to your kids, rather than being good husband and wife to each other. And that's when the depression period really starts, because that time you feel alone, and you suddenly feel that okay, there's nothing here to help me out, because suddenly that one person who you thought was there with you suddenly stopped being with you. And you see yourself as a mother, and you see your husband as a father, and you believe कि यार 100% तो नहीं दे रहा है ना, मैं तो 100% दे रही हूँ. And in that particular moment things starts changing off, and it starts from pregnancy. So to be very frank, I have spoken to around 1,000 mother in my life until now. From matlab, until the day I have become a mother, I started talking out to a lot of mothers, trying to understand their story. And what I realize is that there is a common thing. You have a lot of issues in your head before pregnancy, okay, which you have never sorted out with your husband, your family member, your like near about family members, right? And because that issue has been there in your head, it hits you very hard when you become pregnant, because you're going through a lot of other things. And suddenly the most important people in your life, like for me, my brother was very close to me, my mother, my husband, become the villain of the story, because you suddenly all the mind, like all the gussa, all the judgment that you have will go into them, because you love them the most. And that's the reason you feel that you're disconnected with the people, and the postpartum depression hit you harder, because now you don't have your close people in front of you. So there are a couple of things that I have done, because obviously I am a mother of two kids, so I have gone through back to back two pregnancies. My kids are 2 years apart. So obviously I have seen that journey quite like in a larger way. And I can tell you a couple of things that has really helped me. And when you guys were talking about it, I was just jumping around, should I talk, should I tell few things. So I've wrote it down it, and I will just walk you through what I have understood from my journey. So one thing that I understood the most was, because you feel disconnected with the people who are near you, okay, the most important thing is talk to yourself. That is something that we completely missed. Okay, so what I did for that particular thing is I started writing. So writing, talking to a particular AI tool or anything, or just writing a note in your phone, trust me, it was very very helpful. Like, I just open my note whenever I feel that I'm angry or I'm overthinking. I just write it down in my notes, saying that whatever I was feeling. And you trust me, when you do that, you feel that you're talking to someone, and you suddenly miss that point कि okay, मेरे को कोई problem था क्या इस बारे में, because you're writing it to yourself. So you're talking to yourself. So that is one thing that I have used myself, and that has helped. Second thing is, I used to breastfeed both my kids. They are exclusively breakfast. So when I was in my home, what I used to do is I used to breastfeed the baby, make them sleep, and I used to go on a walk with my friends or my husband, whosoever was available with me that moment, for just 10 minutes or 20 minutes, because obviously I have gone through C-section, so recovery was still going on. People used to say 100 things to me कि आपको ऐसे निकलना नहीं चाहिए, रात को घूम नहीं सकते, सर बांध के निकलो. I used to not listen to it, because I really needed fresh air. Being in home, sitting in hospital, it's very difficult, and people will say 100 things. I used to not listen to it. I used to go on a small walk, 5 minutes, 10 minutes walk, wearing a shawl or something like that. I used to go for a walk, and in that 10 minutes I used to just cry out to my friend, saying that what I'm really feeling. I remember telling my friend that I don't love my kid, and that is the kind of feeling you feel. And that time I was not even aware. 5 years ago we were not talking about postpartum depression. I was not aware that there is a depression that happens to a woman in that particular moment. I used to just nag and tell कि मेरे को ना बस ऐसा लगता है इस बच्चे से दूर रहूं मैं थोड़ी देर. As a mother, accepting that feeling is super hard. So and when you walk, you tell your friends, and they try to understand you. that is the moment you need in your life. That 10 minutes will give you a solution for next day, because next day you will go through again the same kind of shit that you're going on. Like, that problem will still be there in your head, but at least you have the 10 minutes to talk to a person whom you can tell ki bhai meko ye feel ho raha hai. And I will request everyone to have that close circle with you. If you don't have, before bacha planning, plan a friend for yourself. That is the best thing you can do for yourself. So that is the second thing that I used to do. The third thing is that, even you guys were talking about being like, not taking too much on yourself. As a mother, as a woman, we are like, we want to look beautiful for your husband, right? You, even when you're going from the worst phase, you want to look beautiful. If there is any function, you will try to look beautiful. You want to be healthier, you want to feed healthier, you want to go back in shape and wear that beautiful outfit that you had. Because of that, you feel that you are not doing enough for yourself, and you try doing dieting, and you will suddenly feel कि तुम ज्यादा खा रहे हो because of dieting. क्योंकि तुमको तो ऐसा लग रहा है कि तुम्हारा जो डिप्रेशन है वो तो तुमको बोल रहा है ना, तुम और खाओ, तुम और मिठाई खा लो, तुम ये खा लो. And trust me, I have gained 10 kilos of my weight after delivering a baby. And second time when I was pregnant, I was 20 kilo above my size. And it has impacted me a lot, because I was going from postpartum depression. Nobody was talking about it to me. And because of it, I was eating, right? And people used to think kitna kha rahi hai. But what do you do when you just feel that there's nothing in your life, rather than just going and eating? So stop being hard on yourself. You will be okay after 1 year, 2 year, 3 year. तुम कोई आलिया भट्ट, दीपिका पादुकोण नहीं हो जो एक दिन में ठीक हो जाओगे. It's completely fine to be a normal person, completely fine to be a normal mother, and you will get back in shape in 5 years. I would say just take that target कि 5 साल में मेरे को back in shape जाना है, and it's completely fine. Okay, so that is the fourth thing that I was saying. And then the fifth thing is that, most importantly, that has helped me in my life is having a full-time maid. Having a full-time support for yourself is the best thing that you can give to yourself. I would suggest that right now most of the women are working. Okay, and when you're working, there is another kind of pressure that you go through, right? And when you're going through that pressure, having a pressure of home and taking care of home is also another kind of pressure that you add on yourself. So better to have a full-time maid in your final trimester. Have someone, teach someone, tell her how, what help you need, what are the things. And because in this 3 months you can teach that person, and you can move and build that particular help for yourself, that will help. And trust me, after my second pregnancy, the day I had someone to help me full day, my life has been super easy, because you get time for yourself, for your husband, for your family. And that is something that you really really need. So have a full time help, because you cannot be dependent on your parents, because they are not becoming mother and father, they are grandparents, they cannot be your maid. So do not think that they are your maid and they will come and help you date in and out. You need a proper help who will help your parents to take care of the kids, and they will take care of you also, because they will support you in that way. So that is something that I would suggest the new mothers. Then the next thing is that talk to professionals when you feel that you're done, and whenever the thought, mind or the thought is coming to you that you want to die, you want to do something, please take support, take help. And the very very last and important thing that I have done, and I would like to share that with you guys, is that we nobody is talking about it right now, but I want to talk about it, because I really think that there is so much in the world right now, okay, that we can do but we are not doing. Okay, that is the technical, technical support that we can take in this particular time. So as a mother, I would ask Ankita also, like, every 10 minutes we want to wake our baby to just see if the baby is breathing. In that particular moment, you just want to make your baby awake, see if the baby is breathing, and keep it aside. That is one of the signs that you are going through a postpartum depression, and most of the women go through it. So there is a solution by Janitri. I'm very thankful that they have made this technology where the baby can wear a socks in the leg of the in the leg, and it gives you alarm and alert when the baby is not breathing. So you don't have to wake up every minute in the night, because you're already waking up every 2 hours. You can just see an alarm and alert and know that your baby is not doing fine. Okay, so that is a technical, I would say technology is a great help, you need to take it. The second thing that I have gone through is fever in babies, because in each vaccine or in the situation like today, both my kids are affected by viral fever, right? In that particular moment when the baby are already very cranky, you just feel that how do I take the temperature? Because you go to hospital, doctor tells you that why don't you bring the temperature for me, give each hour ka temperature record to me. But there are devices with the help of Janitri, we have built this device which can help you know your baby's continuous fever monitoring, and you can take early action by sharing the report with the doctor. So any big diseases that is there in your baby can be already been informed to the doctor because of the trends that you will share with the report. So these are some of the things that I would like to share, and this has really helped me in the past, and I thought that maybe it can help you guys also. Okay, so that are few things that I would love to share, and also I would suggest people to go for uh, therapy, yoga, mental yoga also before the pregnancies. Like once you come to know that you are pregnant, that will help you a lot to be prepared. So that is something that I would like to share.
Thank you so much, Roshni. It means a lot to us for you being so vulnerable in front of everybody, and walking through your journey, walking all of us through your journey. It means a lot that you shared a lot of things that you were facing, and not just that, all the 5 solutions that you have very cutely noted down on a particular piece of paper. Thank you so much for sharing that with us. So now we open the floor for Q&A. I think the first question, I think, and Dr. Anubhav is the right person to answer. Everybody is the right person to answer. I'm just pointing out of the person who will be able to tackle that question. So at what point would you say postpartum depression has transformed into postpartum psychosis? At what point will you say that? Dr. Anubhav, over to you.
Right. Okay. So, okay, first of all, I think in plain terms, when we're talking about psychosis, it mainly means loss. Usually it means loss of touch from reality. Now it could present as, some delusion, some hallucination. What do I mean by that is, when let's say when the guilt is very excessive, such that it's not getting better by even talking, by sharing. So it could transform into a delusion. There might be some persecutory idea. Persecutory, as in, there might be some paranoia around people are trying to harm me or my baby. There might be ideas about, like I have seen in clinics that mothers sometimes present with ideas that the child is, trying to harm me or the family. Sometimes that is also the presentation, and that also causes the mother to harm the child. So also, like when these symptoms are also presenting, we have to be careful where is it stemming from, and of course with the clinician, not yourself. Uh, Sometimes when we go into the interview in depth, we do we do understand that there are delusions. There might be delusions. Sometimes the mother might also present with hearing voices that this for instance this child is a demon. Like we have seen these things in clinic. Of course, these things would require urgent attention of a clinician. Sometimes even inpatient admissions if feasible. Uh, and of course, the loss of touch from reality. When I say it might also be highlighted in very poor self care, such that it puts the mother or the baby at risk of harm. Or sometimes it might just present as very acute presentations. Within 1 or 2 days of delivery, there might be very acute agitation, aggression, presentation of their sleep disturbances, agitation. So these symptoms are very likely of psychosis, and which would directly mean that you need to take a consult. Like you can't skip a consult; you have to take a consult. Yeah, and I think just I'll add one more thing. Of course, when we also talk about the treatment, whenever there are psychotic symptoms, we do consider antipsychotics. And I also want to acknowledge that in postpartum period also, antipsychotics will have some side effects on breastfeeding on child. but sometimes the benefits outweigh the risk, and we have to consider it. So it's always, you have to discuss that with the clinician. Do not be scared that, what are these drugs gonna do to me. It's always better to just discuss it rather than taking that decision yourself. Yeah.
Great. Thank you so much, Dr.
Can I add one point?
Yes, Vrishti, please.
Dr. Anubhav correctly outlined all the symptoms. Just to add one more, which is a very, very subtle sign that sometimes the mother may go very, very quiet. So that is also not interacting at all with people. And it is not normally quiet. For the lack of a better word, slightly abnormally quiet and confused within herself. So the thoughts of harming the child or harming herself may be happening, all of it internally, but we won't be able to see that. So like he mentioned that the hygiene may drop. Similarly, not talking enough is also another very subtle sign which we can note for.
Totally agreed, Vrishti. So the next question that we have is, what should a mother do when she feels suicidal? Ankita, you want to take that up? You, Vrishti, you and Anubhav can add on whatever Ankita has to say in terms of solution. Yes, over to you, Ankita ji.
So, firstly, Dr. Astha, I'm really grateful that I have personally never come across to this level of a mother who is feeling certain thing. But in terms of yoga, there are 3 different practices which a new mother can do right after their delivery. Okay, just from the very day of their delivery, they can go for it. It is called IRT, which is the instant relaxation technique, which works on you're from your head to your toe. Then comes your QRT, which is a quick relaxation technique, which is for 2 minutes. Again, a different set of practices which we do in yoga, and everything has to be done lying down on the bed. And then comes the DRT, which is a deep relaxation technique. DRT works on various levels, not just the physiological level, but also we have to balance that prana, which I spoke about the very start of our webinar, which is completely disturbed. That needs to get in place. And also at a mental level, because there are various visualization techniques, various meditation techniques that can help someone. So this entire thing is done in that DRT, which is almost for a 20 minutes. So let us say if we do all these processes together, it is a hardly 25 minutes practice, which a new mother can do. And this is where she can, at least let go the thoughts, because having suicidal thought is something which is beyond anything, right? This is the most ultimate thing a person could think, ending the life, right? So this is where we need to work at all these levels in terms of physical, prana, and mental. So this can be done to tackle a situation of suicidal thoughts. But yes, I've never experienced something, and I'm glad I've never experienced that. So maybe, Dr. Anubhav and Vrishti can add to this.
I'm glad that you have not. Vrishti, anything that you have want to add?
Yeah, sure. Just one more perspective on this, that why or how would a person go up to the level of feeling suicidal could also be because it may begin with the feeling of losing control over everything around me and within me. So it begins from that, goes up to the level of a lot of anxiety, feeling really overwhelmed, and eventually the feeling of hopelessness. अब कुछ हो भी नहीं सकता, ये ऐसा ही रहेगा. That is when it goes to the level of I do not wish to endure this anymore, and it would be more peaceful to not be alive. That is exactly where I would want to interject with this phase is not permanent, it is a temporary phase. You will outgrow this, and for us to help you, you have to allow us to help you. So, whenever this type of thought strikes, reach out to anybody you trust. Beginning with how Roshni mentioned, you can give yourself a voice note or write out. Start with that. Share it with someone who you trust. Can also be absolutely unrelated to your family, even not if not even your husband, anybody else. But speak it out. That would be the first thing. Second thing, medical intervention would be of utmost importance at this time because it's the anxiety that is taking the best of you. I think Dr. Anubhav would shed more light on how that can help further. But I think talking about it and then having a professional by your side to give you another perspective will help you hold back from it. Another last important thing would be to have a safety kit. Like we have first aid kit at our home, similarly, we can always have a crisis helpline, or what to do when I feel that nothing is working out during the days of hopelessness. This is what your safety kit can contain. And that is what you can keep handy. Whenever I feel like this, I have this number that I can immediately dial and vomit out my feelings so that you don't have to endure it alone. This is extremely essential. Consider it not an option, but a necessity.
Great. Thank you so much, Vrishti. Now over to Dr. Anubhav. What do you have to say about this?
Yeah. Okay, I think Vrishti has summed it up well. I would again like to emphasize, see, suicidal thoughts, I would consider them an emergency. Now, of course, suicidality can look different with different people. Sometimes it's a passive thought that, life is not worth living. It's better if I just die. The second is, that you're planning something, you're actively thinking that you're going to act on these thoughts. So, of course, there are levels of risk as well, but I do not want to go into the details. But see, you have to seek professional help for that. Also, we need to have that patience. I would not say that, once you walk into the clinic, whether with a therapist, with a psychiatrist, that things are going to get better just the next moment. It takes some time, it takes patience. And of course, the very important part is support. See, there are certain things we do keep in mind when when we're also telling the family members or anybody who's accompanying the person who is suicidal, to be around the person all the time. Make sure that if there are certain things that the person might use to harm themselves are kept at some distance, so that there is some barrier between things. Because when these suicidal thoughts also take over your mind, there is a lot of impulsivity that might be associated with it, and the person might not have that control over those thoughts. And also sometimes the hurt and pain is so much that suicide seems like the only option. So I think that time the importance of support and having those people around is very helpful. And there's no shame or guilt in sharing these things. Of course, in our society overall also, we often say that it's a sign of weakness, but of course it's not. It's literally a cry for help, that the person needs help. So if there are also any suicidal behaviors, I would say, such as writing your will, or just discussing something with the partner or anybody that I don't think life is worth living, do not ignore these signs. Go for professional help. There's literally no harm in going for help. Yeah.
Yes. Thank you so much, Dr. Anubhav. I think with this, we wrap up the Q&A round and we move on to the conclusion of this webinar. Trust me when I say this is one conversation which I will always, always remember and keep very close to my heart. I'm not a mother, but all three perspectives were so new and refreshing in terms of the take towards one particular diagnosis, that is postpartum depression. I am glad we picked this topic. I am glad we did not go ahead with just one perspective, but three of them. And it was such a refreshing take from each one of you. How will you tackle a particular problem? And exactly that is what we envisaged when we were planning to have three panelists. That exactly different perspectives for one particular problem and one particular solution. Thank you so much. Genuinely, thank you so much, Dr. Anubhav, Vrishti, and Ankita ji. Thank you so much for agreeing for being the panelist for this webinar. And Anubhav and Vrishti specifically, why this is super special for me because of the Ryan International School, of course. And you genuinely took me back to my childhood. And thank you, Ankita ji, for agreeing in seconds for this particular webinar. And your passion is something that really resonates with me, because you really want to bring a change in this particular healthcare sphere. And Dr. Anubhav, thank you so much for taking up time. I understand you were super busy. You have always been super busy. So thank you so much for an hour or so with us. And Vrishti, you were as cute as you were always. So thank you so much for sharing your perspective with us. And thank you again, all of you guys. So thank you so much. Yeah.
Thank you.
Thank you, Astha, for organizing this because this was much needed. I mean, it was just not the title of this webinar, the untold story. It is the reality. Like, no one talks about it. So it's better you know it and then you prepare yourself for it. And as Roshni said, find a friend first, then plan a baby. At least have someone by your side with to whom you can just fall back whenever you want. You should always have that one person in life. कुछ भी करो उसको बता के करो and it will be like always you will be easily able to pass the journey. So thank you, Janitri, for conducting such a beautiful and informative session.
Thank you so much, Ankita. Thank you so much. Means a lot.
Thank you.
It's been great being in this webinar, and thank you, Janitri team. Thank you, Vrishti and Ankita. It's been very enlightening hearing your perspectives as well. And I think it was very it was very good to also reconnect with Astha and Vrishti after years. So yeah, it's been a good experience.
Yeah, my feelings are likewise. I'm very happy. And like Astha said, that there were three different perspectives to the same problem, and they were so refreshingly different coming into unison. I'm super happy that we did this, and I look forward to more of it. Thank you.
Also, one more very important thing: this particular YouTube link and stays on our YouTube channel. Anyone that you want to refer this particular video to, you can refer that to your patients or whoever you think is in the need of that. So yes, that stays on our YouTube channel in a
Wonderful.
nutshell. Yes. Thank you so much, guys. Again, thank you so much.
Thank you.
Good luck. Good luck. Thank you, guys.
Yes. I've ended